Welcome to our podcast program, Jen.
Thank you for having me.
Give me your short introduction.
My name is Jenny. I'm a newly qualified occupational therapist from England, and I've just graduated from doing my master's, and I'm yet to receive my registration, and then I will be practicing in the UK when I return from Nepal in a couple of weeks.
Okay. So today is October 27th, and it is regarded as Occupational Therapy Day, and it is celebrated worldwide. On the occasion of Occupational Therapy Day, could you explain to our listeners what exactly is OT, or occupational therapy, and why is it celebrated on October 27th every year?
Okay, yeah, sure. So occupational therapy, it's a health profession, and it basically promotes health and well-being by using occupations as the focus of the therapy. And when I say occupations, a lot of people think that means our work and our profession, but actually when we use the word occupation in occupational therapy terms, it basically means anything, any activity in our daily life that is meaningful and gives us a sense of purpose in life. So it could be spending time with our friends and our family, doing leisure activities that we enjoy, like our hobbies, and it can also be the kind of routinely things like cooking and getting washed and dressed and the sort of day-to-day activities that fill our lives.
Okay, so you make the patients do all those activities?
So we make sure people are able to participate in their activities in order for them to feel a sense of purpose in life. When people have something happen to them in their life, like they have an injury or a disability or an illness or something, a large life event that disrupts their life, sometimes you lose the ability to carry on in your daily life and the activities in it. So we work with people of all ages and from all backgrounds, and we try and rehabilitate them back into life and being as independent as possible.
Could you tell a little bit about Occupational Therapy Day?
Yeah, sure. So Occupational Therapy Day, it's an annual event. It's hosted by the World Federation of Occupational Therapists, which is the international voice for our profession. And basically they started this day in 2010 to promote and celebrate our profession, because it's still there's still quite little awareness about the profession internationally. So it helps to spread the word about our cause and what we do with people. And hopefully all the different organisations around the world that know about occupational therapy will be doing their job to spread the message as well.
So occupational therapy is quite new. Am I right to say that?
It's still developing profession. Yeah, it's kind of new. It started in the 1920s. It started before that, but officially it was called occupational therapy in America in 1920. And they used activities back then with people who had different diseases like tuberculosis and AIDS, and they used tasks and activities to help people regain their health. The healing properties of occupation has been acknowledged for a very long time, but it's rapidly changing and growing and spreading across the world.
Okay. In what way does OT help in the treatment of mentally ill people?
Okay, so with mental health, it's very client-centered. You're working with people who are very individual and have very specific needs to them, and we start by talking with the patients who have these mental health issues and understanding what is important to them and what they are lacking in their life. And they may have barriers to these occupations because of their health, but they also might have barriers because of social exclusion and stigmas. So we talk to the patients about what they would like to be doing in order to be feeling like their life is purposeful, and then we We assess their function in their tasks, so we observe them doing different activities and how they're getting on with them. Are they able to participate? Are they able to socialise? And then we support them in regaining their independence and their function as much as possible. So we will often use different activities as the intervention. So we'll do group sessions with other people who have mental health issues, and that will help regain some of their social skills and their practical skills when we're doing the sessions together. So for example, sessions could be reading and writing groups, but it also could be that's kind of like leisure activities we could do with them, but we could also do practical activities like cooking and helping them wash themselves if they've lost that skill. And we can also help them to have a role, which is very important in occupational therapy. People often lose their roles in life, and that means you lose your purpose in life. So we try and regain people's roles, and a role can be anything from being a friend or to being a kitchen helper, or it can be anything that you feel you're having a responsibility for and gives you a good feeling.
So it is all activity based only?
It's all activities, anything that occupies your time in life and makes you feel like your day is worth getting up for and participating in life, yeah.
So in mental health, like we have many sort of patients, like some are psychotic and some are neurotic. Do you think OT is helpful for psychotic patients also?
I think OT is helpful for everyone, but then I would say that. But I think that for psychotic patients or any patient with any specific need is able to participate to some degree. Some people are much lower functioning or less able than other people, but when you're working with people, you understand that they are able to do something, and it's the doing something that gives them value and purpose in their day. So even if they're acutely unwell and severely psychotic, you can still help them to engage in an activity if they have the right support.
So you have been in Amrita for since a month?
Yeah, that's right.
So what's your experience here? What activities did you involve the patients in Amrita?
Okay, so there's up to 100 patients in Amrita, and they're all here for very different reasons. Some have a similar diagnosis, but they're still very, very different from each other. So I've been working with large groups of people with very varying needs, and trying to enable them in their own way to participate in the activities I've been doing. So I've been running group therapy sessions in which I invite patients to join me in an activity such as music, writing and reading. We've had discussion groups where we've talked about a subject and spoken about how we feel about it. We've done breathing and relaxation groups. We've done a lot of art groups because that enables people to participate as much or as little as possible, and it doesn't require people to talk either, which is very helpful when people are quite socially removed.
Yeah, while you were working here, is there any particular experience or event that was insightful to you?
So as I've just said, the patients are all very different in their individual ways, and there's a huge different level of ability to participate, and some people have been more able and some people have been less able. And one thing I've learned is that it's really important that everybody has the chance to be included in the activities, because there are many people here who are quite unwell, mentally unwell, and there may be an inkling to exclude them from activities because either their behaviour is difficult to manage, or perhaps it's presumed that they can't do something. But actually, when I've included people who do need a lot of support and are challenging, they've still been able to participate in the activities, and that's been a really positive experience. And it has shown me and others that they are able to do things.
How was the response from the participants?
From the patients?
Yeah.
So we've had a mixture. There's been a lot of enthusiasm from patients here. I think they really appreciate having something to do in their day. It gives them a reason to get out of bed and see the day, and also help pass time, which I think a lot of them find very difficult here when they're here for a while. We've had some patients who have had difficulty attending the groups, and this is largely because of their condition. So very commonly a symptom of many mental health conditions is low motivation and low attention. So when people have no motivation because of their illness, it's very difficult to tempt them out of bed sometimes and to get them to come out and join in the activities. So it has been a mixture, but on the whole, most people have been very, very glad to have an activity to do in the day.
Have you seen any changes in their behaviors due to the activities?
Yeah, I've seen a lot of change actually. In 1 month, I've seen a lot of improvement in many of the patients. There's some people in particular who I think have done extremely well and have actually adopted roles within the groups. So they've kind of become used to the groups happening, and as the days have gone by, they've acquired a role for themselves in that session, and they've been very helpful and have been very enthusiastic to assist in the session, which is something I really wanted to achieve, because when I leave, it would be really great if patients themselves could be motivated to lead activities themselves, and everything is here for them. If they wish to do activities, it's possible with the right support. So it's been good to see some patients acquire these roles, and I've arrived some days and people who were very unwell at the beginning are now ready, waiting for me to arrive, and are wanting to get the groups started and get outside and start drawing again or writing their poems again. So it's been really good.
Okay. In mental health services, there are many professionals involved, like psychiatrists, psychologists, counselors, psychiatric nurse, and social workers. So in the whole mental health service, how can OT fit in the that integrated mental health service? You can tell from where you have come from. How is it practiced in England?
Okay. Yeah. So we call it the multidisciplinary team, which is all the different disciplines working together for the best interest of the patients. And in England, it's a very important part of the service that we run. Because the key to good health and social care, in my thoughts, is that communication amongst other professionals is really important, because every day that patient that you're working with sees all of the different professionals, and if the professional has witnessed something with that patient, then it's very important that we share that and communicate with each other in order to best understand our patients' needs and make sure that they're getting the right care. So it's a great part of the job, is working with other professionals, and you also learn a lot from other professionals. So we learn from each other. So when I'm working with psychologists and physiotherapists and speech and language therapists, you actually learn a lot about their profession, and that feeds into your own practice very much as well.
Okay. Now, while you have been working here, have any thought crossed your mind about the future of OT in Nepal?
Yeah, I think it's definitely a positive outlook.
Okay.
The more awareness about mental health, the better, and that naturally draws more professionals into the realm of mental health and also physical health. Like any kind of awareness programs which are happening, that draws the attention and it brings professionals together. So I think that for the future of OT in Nepal, I think it's positive, and I have heard of other OTs and been connected with other OTs here whilst I've been here in just 1 month.
Okay.
And I think there are huge potentials. There's a lot of people in Nepal who would benefit from occupational therapy, and I wish very much that OTs will come here and work with people here, and it's been a pleasure for me. So I think hopefully more people will come.
Thank you so much, Jenny, for your time.
Thank you for having me. I've enjoyed it.